Good afternoon, everyone. Thanks for joining us on our media briefing for this Friday. We have a lot on our agenda today, so we're going to get started. We are pleased to be able to be joined by the incident commander of the Dolan fire, Rob Allen, and PIO Chris Barth. They'll give us an update on the Dolan fire at noon today. Thanks for joining us.
Good afternoon, everyone. Thank you for fitting us into your schedule early so that we could get back to some other meetings, but appreciate the opportunity. My name is Chris Barth. I'm Public Information Officer with PNW Team 2, and with me is...
Good afternoon. I'm Rob Allen. I'm the Incident Commander for PNW 2.
So I'll start with the numbers. Apologize for that. I'll start with the numbers. Today, the fire is currently at 113,486 acres, 26% contained. We have just over 800 personnel that are currently assigned to the fire. And I understand that some of the questions that you were interested in, looking at the base camp, potential move to King City, and why the fire might be impacting more residents, and also providing a midday update on that. So with that, I'll hand it back over to Rob.
All right, thanks. Yeah, again, I'll just echo thanks for taking the time to let us talk with you this morning. I appreciate that. It's all helpful to get our message out. The first one, the transition from Big Sur over to King City, as things wrap up here on the west side of the fire, things are looking really good from here all the way down to the Nacimiento-Ferguson Road. And we're buttoning some of the stuff up around the Hermitage. And as that works out, more of our activity and more of the workload that we'll have will be on the east side. And so our transition is from having several hundred people working here and like 90 folks working on the other side. We'll start shifting resources over to the east side, and more of our people will be there. So working out of King City will make it easier for us also to communicate with our cooperators that are on the east side as we're starting to impact them. When we look at why the fire might be impacting more residents, and the big part of us trying to get this fire under control is the resource availability. So that's our availability to have engines and hand crews and dozers and helicopters and all of that. And I'm sure, as everybody has seen, if you look on the news, all of those assets are in very short supply up and down the West Coast. There are fires in California that are a pretty good size with evacuations going on that don't have a team like ours on it, and have very limited access to stuff themselves. So we're trying to make things available for everybody, as well as try to take care of our footprint here. And some of the places where we're trying to fight fire, we just don't have enough resources to be able to get in there. We feel pretty comfortable that we have the resources we need to do site protection on the homes that we do have, the residents and the commercial buildings and stuff that we have identified. We're working on hardening up those plans, and that's kind of how, as we organize, we start off with our top priority being life and firefighter and public safety, and then we go to property. And we'll start with hardening up around the places where we need to be to protect those. And then we'll start looking at opportunities to shrink the size of the fire, where we can go up into the woods and put in dozer lines or use roads or trails to try to contain the fire that way. And as far as a mid-afternoon effort, we're kind of where we are right now. Today, we're having a pretty good day. This marine layer is pushed in pretty far. And yesterday was also a very good day with the change in the weather. The winds coming out of the south has made it a little bit easier for us to be able to get into places, unlike the previous days before that, when the fire doubled in size in one evening under that extremely hot, dry weather with the marine layer pushed way off the coast. So today things are going pretty well. Crews are down on the south end doing some burnout operations and trying to secure that to keep it from going any farther to the south. We're working closely with the folks at Fort Hunter Liggett to stop the fire spread any farther onto the base, and then working our way out up and around to Arroyo Seco, and then back over to our west side where we tie in on the other side of the Sobranes fire, where things are looking really good. So we've got one whole branch that's pretty much in patrol and monitors phase. We've got 2 more that are getting close to getting to where we might be able to do that. And then we've got some where we're still out actively trying to find where we're going to put in lines. A lot of work is being done on that east side with conjunction with CAL FIRE to open up some of the lines that they had put in place for the Indians fire and use those in some of our control features. So unless there's any questions, I think that's our kind of our update for today.
Thank you very much. I really appreciate you taking the time. We usually wait till all of our presenters have finished, but because our time is limited, if there are any questions for our Dolan Fire representatives, now is the time to ask them because we're going to lose them shortly. So I will go to chat and see if there's any questions there, but if people want to ask just verbally, they can. I'll start with this chat question. The containment date on your website for the Dolan Fire is September 28th. Are you confident of that, or do you think there will be a change?
There will most certainly be a change. Just looking at the weather forecast right now, and the amount of ground that we're trying to cover, and the assets that we have to do that work with, is going to be challenging. Just because there are other fires in the state of California right now that are actually actively burning up homes, and those take priority over ours. They'll leave us with the assets that we need to protect what we have, but we'll start losing some of our ability to contain this fire, which is putting a line all the way around it and stopping its forward progress until we can start freeing up some other resources from other fires. So that date will change. We're trying to kind of figure out where we are right now and what that might look like. And a lot of that for us will depend on the weather. If the weather can cooperate like it is now, especially down on that south end, where although we're sitting in pretty cool temperatures right here on the coast, as you all know, you don't have to go too far up into the mountains there, and the weather pattern and the behavior of the fire is completely different. So that date will change. We're just trying to calculate what that right date might look like.
Well, and that may answer the follow-up question from this reporter: is the containment date to be determined? So I think the answer is yes, to be determined.
Yes, it is. I'm looking at what we're going to be able to replace as our crews. You know, they can only work for so long, and then we've got to get them some time off to recoup and regenerate. It's hard, taxing work out there. And as some of them are leaving for days off, when they're getting reassigned, it's not getting reassigned, unfortunately, back to us. They're being prioritized to fires that are of higher priority in the region.
So I've got another question for you. While there are considered enough resources on the fire right now, during a normal year, would there be more? And what is your team not able to do at this point that would normally be happening at this time?
Well, I think normal is a kind of odd term for us to use nowadays. Just it doesn't seem like we've had a normal fire season in quite a while, whether it's here or up in Oregon and Washington. But we would normally, if there was only 1 or 2 fires, we can draw from all of the national assets that are out there, and they've been working really hard to keep us at sale. For example, one of our key tools is Type 1 interagency hotshot crews. And those Type 1 crews are very experienced, very skilled. They're a big motor out there for trying to put lines in. When we got here, we had 9. We're down to 6 right now, and we're going to be losing a couple more days off here shortly. And there are no crews to come back in because they're being used in other places where they're actively evacuating homes and trying to keep fire out of communities. As long as we're burning up in the wilderness where we are now, we have some time and space to maneuver. And like I said, we're hardening up around the communities that we know are the next ones that could be threatened. And you'll see people there working, people getting set up. And then as we get those tools back in, we'll start looking at where we can re-engage the fire on the fire's edge itself and try to pick that up.
All right, thank you. Another question for you. Can you provide additional details on the shelter deployment from Monday night? Did the weather shift on the fire, or did the fire behavior change unexpectedly? Can you also provide a condition on the 3 firefighters who had to be airlifted?
I sure can. We have a learning response team here right now that'll be looking at the fire, and we'll be getting out more information. We should have a 72-hour report out here pretty soon, also to highlight and answer some of those questions. But for right now, I can tell you that, yeah, the fire behavior we saw that night was very extreme, and extreme even for Southern California, especially to be burning all night long, and to have the size of the smoke column that was up there for as long as it was is very unusual. And it just was after 3 days of over 100-degree temperatures and very low relative humidities caused it to burn very erratically. So when it did come up there, it was moving quite quickly, and we were scrambling to get things out of harm's way as it came in. And now
the condition of the firefighters. The condition of the firefighters.
Two of the firefighters that had gone in had smoke inhalation issues. They've been released from the hospital or at home with family. We've had some of the other firefighters that were also there have all been checked out again by medical professionals and are doing well. The third patient, or the first one that was our most priority patient, is still at the burn center in Fresno. He has burns to parts of his body, and they're working on treatment for those right now. His family and friends are also there in Fresno, and a shout out to the Wildland Firefighter Foundation has been awesome in helping out the families of all of the folks that were in that accident, and helping them with the things that they need.
All right. Thank you. And then one more question. Is there an update on structures threatened or destroyed?
We've not lost any more structures to this date. So the same numbers that we put out this morning are those numbers. Structures threatened are also still the same right now. We're working really hard to keep the fire up on McCarran Ridge and some of our areas up there on that south end. We've been working with the Sheriff's Department here today, given the weather and how things look, to reevaluate and shuffle around some of the evacuation warnings and orders that are out right now. And that'll be an ongoing process for the next few days as we see what direction and what the weather's going to do to us.
All right, thank you. That is the last question that I have. It's about 12:15, so I'm thinking that maybe this may be your time to exit. If I get any other questions, I'll be happy to forward them by email to you and see if we can get a response. I really appreciate you guys being able to take the time to join us today.
Thank you. I appreciate that. I just want to also add to make sure I do recognize some of the names on the screen, and so I know folks are familiar about where to get information, but I do just want to remind folks they can get updated information on InciWeb, on the Los Padres National Forest Facebook page and Twitter. We also are encouraging folks to visit the Monterey County OES interactive website for the latest information on evacuations, and those are changing pretty fluidly as the fire conditions changing, both increasing and lowering back to advisories or being removed. So encourage people to check that interactive website to see the latest condition on the evacuations. If they do have questions, if folks do have questions about evacuations, we encourage them to call 211. That's going to be the best source of information to get additional questions answered about evacuations. And then if anyone has questions, again, they can email us at 2020.dolan@firenet.gov or call us at 831-272-0222. And lastly, I'll just remind folks that we do have a virtual public meeting that's scheduled for tomorrow, Saturday. That will take place at 2 p.m. Pacific, and it will be on the Los Padres National Forest Facebook page.
Thank you very much.
Thanks
for filling us out.
For giving us the opportunity.
Great to have you. Take care.
Thank you.
All right, we're going to keep on with the fire theme. We're joined now by Hillary Thayer, our library director, where the libraries have really joined in the firefight to assist the Dolan evacuees. Hi, Hillary.
Hi, thank you so much for giving me a few minutes today just to talk about the King City Library Evacuation Center. Library employees are disaster service workers with employees of the county. And now branch libraries have served as evacuation centers for the River Fire, the Carmel Fire, and now the Dolan Fire. Right now, the King City Library is serving as an evacuation center. and it's open 24/7 until no longer needed. Evacuation centers are a place people can stop and get connected with the resources they need. So for example, we have staff who can register evacuees for shelter in a hotel or for an RV spot at the fairgrounds. We are also often just giving information using the county's resources, the other agencies' resources to connect them with whatever they do need. Pointing them at that fire's website, showing them how to use the map, giving them resources to call for their animals, that type of thing. The library already has robust wireless internet, so some people simply need a place to sit, charge their cell phone, and figure out their next step, whether they're calling family or friends to find a place to stay, or they're making hotel reservations on their own. So we can provide a place to do that as well. We're working with the county on the 24/7 staffing, but most of the time you're going to find one of your local South County library staff there at the evacuation center. The work we're doing is really right up our alley. It's what we do at the library. We're just using a different set of resources to do it. Information can change rapidly, so often we're texting back and forth with the Emergency Operations Center to get updated phone numbers, getting updated forms, and it's just fluid throughout the day. So we're always in touch at the evac center. You can call us if you cannot get to King City. You're an evacuee, you can call us and we can do hotel intake over the phone as long as you have a way for the confirmation to come back to you, like a cell phone. Our phone number is the regular library's phone number, 831-385-3677. That is also on the 2020 Fires County website. We can do a lot over the phone. We can also assist you with information over the phone if you cannot get to King City. That is okay. Also, if you don't have a cell phone, you can come to the King City Evacuation Center and we can arrange for the confirmation for shelter to come back to the library. And then we would give it to you there. I just want to take a moment to share my gratitude to our libraries team. They're awesome, they're stepping up. They step up every time, and in these fires, serving as evacuation centers, we've been really, really proud to serve our communities. So I'm able to answer any questions you may have about the library as an evacuation center.
Thank you very much, Hillary. We'll hold questions for Hillary until we finish up our other presenters. We have Tracy Molfino also on the line. He is going to share with us some information about the local assistance center that has been up for the last couple of weeks, assisting fire evacuees with disaster assistance and recovery. And that assistance center is scheduled to close tomorrow evening. So we want to get a last plug in for evacuees to come and get those services. Hi, Tracy. I see him, but he's muted. So we'll give him a chance to see if he can, there he is. Gotcha.
Here I am.
Hi,
the
Tracy.
Monterey
Thanks
County
for joining
Office.
us.
Hi, thank you. The Monterey County Office of Emergency Services will be winding down the local assistance center tomorrow evening at 6 o'clock. After 2 full weeks of being at the Monterey Conference Center and providing assistance to fire victims of all types, from individuals that had to evacuate all 3 fires to those seeking assistance with state resources who may have lost documents in the fire, to registering with FEMA. We had both federal, state, and local agencies there. We saw about just over 250 families at the local assistance center who applied for aid through FEMA and through the state. Though we are going to stop the physical operations at the Monterey Conference Center, that doesn't mean we're stopping assistance at all. All the links to all the agencies are online at the Monterey County Office of Emergency Services website for the virtual local assistance center. FEMA is still accepting applications, and currently this will take place through mid to late October, and there will most likely be an extension to that. But it really benefits everybody that has suffered a loss to apply as soon as possible. You can apply through FEMA's application, on like a phone application on their website, or calling them once the local assistance center is closed. They've received, I think, 280 or so initial applications for aid, and this is anything from seeking assistance in paying for hotel rooms at out-of-pocket expenses for evacuations, all the way up and through loss of house or structure, that sort of thing. We are seeing individuals who initially have to come twice and talk to FEMA if there's what they're calling a rejection in the initial application. That doesn't mean that it's a final rejection. It means that additional paperwork or information is needed. And an example of that, if someone was evacuated from, say, the river fire and had hotel expenses, and they submitted through FEMA for reimbursement for those hotel expenses and received a rejection, it most likely means that FEMA would like you to confirm with your insurance company that it's not covered, and to provide that insurance paperwork. FEMA indicates that the insurance company is the first source of funds for an individual's loss, and then eventually FEMA comes online. There's also a process for SBA, the Small Business Administration, for loans and that sort of relief. So, long story short, if you apply through FEMA for assistance, you get a rejection. That's not the end. You need to recontact FEMA and provide them the information they need. Worst case scenario, they're also on FEMA's website, as well as the Monterey County Office of Emergency Services website, free legal aid to assist in the process. That's through FEMA, and a grant from FEMA to a law firm throughout the state that can assist in that process. So again, we'll be closing the Monterey Conference Center tomorrow at 6 o'clock, but going to virtual operations, and FEMA will be taking their vehicles around the county to make sure that everybody who should apply does apply. They're currently out on Kashawa Road right now with one of their FEMA vehicles taking applications. So that's it.
Thank you very much, Tracy. If you could stay on the line for any questions.
Sure.
Great. And I'm seeing Charles McKee pop up. Do you have something you'd like to share?
Yeah, I would just like to add in that, that as the conference center is closing, because some of the needs closer to the conference center in Monterey may be winding down, and the work that everybody's been doing there has been fantastic, and it's it shows what local government and state and federal government can do coming together to help. But as that winds down, we know that there's going to be some continuing need for those who either most recently may have evacuated for the Dolan fire, or may still be needing to evacuate in the future from the Dolan fire. And as Tracy said, it doesn't mean that the assistance resources are ending. They're going to be the virtual assistance resources. I know Hillary and her staff at the library will also be able to assist in getting evacuees to the right place for some of the assistance that might be needed in those times. So the King City Library, as Hillary was saying, is going to be open, and as you can see in the chat, it's going to be open until we think that the need is not there. Just want to make sure that those people who are impacted by the Dolan fire as we go forward, and others who, if you haven't registered yet, and you're impacted by the River or Carmel fire, you also make contact through virtually or calling our Office of Emergency Services. There's a lot of website links, but also if you needed to go into the library there in King City, I'm sure they'd be more than willing to help.
All right, thank you very much. Thanks for reinforcing that for everyone. Now we're going to pivot from the fire back to COVID-19, and we've got several people from the health department and related programs to talk about some interesting programs going on. And we're going to start with Krista Hani, who's a program manager of our planning, evaluation, and policy section of the health department, and she's going to introduce two of her interns and talk about this fantastic program that they're doing outreach on WhatsApp. So, hi, Krista, take it away.
Maya. Well, there's been a lot of great outreach being done by you, Maya, and Karen Smith, our PIO, and we recognized that part of what we'd like to do is also add to that with some outreach ideas that we've gotten from a few of our other fellow county partners from Ventura County using WhatsApp. And we had 2 Health Career Connect interns working with us this summer that we've also continued working with us in paid internships. Maria Jose Gonzalez Anaya and Alondra Ruiz. And they are going to present to you on our new WhatsApp project initiative to do outreach on COVID-19, but also other events like the fires and the evacuations, et cetera, to our farm worker community. Maria Jose? And just take yourself off mute.
Yes, hello everyone. Thank you so much for giving us the opportunity to be here. I'll go ahead and share my screen to share the presentation that we prepared for everyone. So just one second. Yeah, so thank you, Krista, for that introduction. We'll be talking about the COVID-19 WhatsApp group overview. My name is Maria Jose Gonzalez, and my fellow intern is Alondra Ruiz. So for starters, what exactly is WhatsApp and how does it work? WhatsApp is a free app for iPhones and Android smartphones that allows people to send messages, pictures, videos, and even voice recordings, and as well as making voice and video calls over the internet for free, rather than using a mobile network that may cost money. So one of the main reasons that we decided to do this WhatsApp group is one, that it's really cheap. It allows users to send messages and communicate with other people over the internet. So it bypasses phone carriers that may otherwise charge for the same services. And it also very popular among the Latinx and immigrant community in the US. So the main goal of this project is to provide accurate information about COVID-19 to help our Spanish speaking community protect themselves against the virus and avoid its spreads, the spreading of it, given that the Latinx community has been the most affected by the pandemic so far. So this is like a general overview of how the group chat is operating at the moment. So the group is administrated mainly by 2 people, which is myself and Alondra. And we prepare the calendar of the messages that has been sent out, collaborating with other staff from the health department. And the administrator of the account organizes participants into different groups. So far, we only have 1 group, but moving forward, depending on the dynamics that we see in the group and how many people sign up, we might consider dividing everyone into multiple groups. So once people add the number associated with the WhatsApp account, they send a message to us and we add them to the group chat. And we send a welcoming message to them with, saying that the purpose of the WhatsApp group, as well with general rules, which include just being respectful of other people and understanding that the group chat is only for COVID-19 purposes and other relevant information about the county, and it's not a social group chat. So overall, so far we have been sending about 2 to 3 messages per week. And the messages include any relevant information such as county updates, infographics, resources, and so on. We include things related to COVID-19, and now we're gonna start sending updates regarding the wildfires going on. And with that, I'll pass it on to my fellow intern, Alondra, to continue the presentation.
Yeah, thank you, Maria Jose. Well, hi everyone, I'm Alondra Ruiz. I'm the other intern in the Monterey County Health Department. And as you can see here, we have the welcome message that says welcome to the WhatsApp group, and it has the general rules. We have the county logo here just to make it look like official, because it is an official group. Once we add the person there, we're going to send out another message letting them know how the platform will be used, meaning it's not for like personal reasons, or is not to have a social group. It is to inform each other about COVID-19, the fires, and the things that could be happening at the Monterey County. Can you go next? So community outreach. The way we are promoting the WhatsApp group is by creating flyers and posting them around community areas or websites such as the Monterey County website. Social media posts, we post the flyer on social media, so we create awareness of this service that we are providing. Make posters for places that the Spanish speaking community goes to, for example, grocery stores or panaderias, which is like the bread stores that a lot of Spanish speaking people frequent. And then we reach out to representatives of community organizations. For example, reaching out to people from Hartnell College. Maria Jose is reaching out to people from Milpa and so on. Reach out to clinics and community testing sites. I believe this is a really important way to reach out to the community, because a lot of people that are concerned about their health might go and get tested, or they're feeling any symptoms. The first thing they think about is going to the doctor, and once they go there, if they get information about the services we're providing, I think it's a good opportunity to keep them informed. Create a snowball effect with our Spanish speaking social network. Again, letting somebody know, and that have that person letting more people know, and those groups let other people know, and so on. Okay, so this is our flyer. Here, well, it's in Spanish, but it says, keep yourself informed, join the group from the Monterey County Health Department to obtain more information, news in ways to remain safe during the pandemic. Then we have the phone number here, and letting people know that they need to message this number to be added to the group. And for more information, so of course, visit our website at montereycountycovid19.com. Okay, so this is it about our presentation. Thank you for your attention. If you have any questions or comments, let us know. We're here to answer.
Thank you all for this great presentation. If you could stay with us until everyone else is finished, we'll get to questions to you. We're going to pivot over to Diana Jimenez from the Department of Social Services. She's going to give us an update on the Great Plates Delivered program, which is so great that it's still going on. Hi, Diana.
Hi, good afternoon, and thank you, Maya, for the opportunity to provide an update. So the Great Plates Delivered program was extended through October 9th by FEMA's Public Assistance Program. We have increased the number of seniors we can serve through this program from 200 to 300, and we are accepting more applications. Interested seniors can call United Way's 211 for screening and referral information. Currently, we're serving 220 seniors, and we have contracted with 8 restaurants to provide the meals. We will be adding more businesses to help meet the growing need of the seniors that will be served through this program. And just as a reminder, the Great Plates Delivered program was started in May of this year, and it has 2 goals. The first one is to help seniors 60 and over who are at risk of COVID-19 or contracting it to stay home and stay healthy by delivering nutritious meals. The second goal is to provide essential economic stimulus to local businesses who are struggling to stay afloat during this pandemic. Participating seniors receive 3 meals a day, 7 days a week, and it includes seniors in North Monterey County, the Peninsula, Marina, South County, Salinas, and Spreckles. The selected businesses for this program are geographically spread out across the county, and it includes Stevie's Family Restaurant in Prundale, Linda's Taqueria in Gonzales, Pork and Plow in King City, Coastal Cuisine and Catering in Monterey, Denny's Restaurant in Marina, and 3 restaurants from Salinas include Main Street Bakery and Catering, the Monterey Coast Brewing Company, and Pasta Mia. I want to again thank United Way and the 211 staff for helping us screen potential participants. And I also want to extend my gratitude to you and the media for allowing this opportunity to help spread the word. So thank you again.
Thank you, Diana. And if you would again stand by for any questions, we have one more speaker. We're glad to be able to have Dr. Moreno on the call this afternoon, and he's going to give us an update on the tier framework. Good afternoon, Dr. Moreno.
There we go. All right. Welcome, everybody. So a lot of folks are aware of the change to the way that California monitors the status of counties with regards to the spread of COVID-19 in each community. And there has been a recent change, and that is the governor and California Department of Public Health rolled out the California Blueprint for a Safer Economy. Just to be clear, there are some similarities when we look at what was part of the that monitoring program in the past and what we have now. There are some similarities, and but the intent was for the blueprint with its tier framework to replace the county monitoring program. So the new program can be found on details can be found on the state website. So I won't get into the details, but I'll just try to summarize what that means for Monterey County. So the state continues to look at some metrics. They're looking at the case rate, and they're looking at the testing and positivity rates in each county. And based on the rates determine which tier a county will fall into. And so Monterey County was on the monitoring list and had certain restrictions for certain businesses and school reopening for in-class instruction. And based on the case rate, when the state switched over to the new tier framework, Monterey County fell into one of the 4 tiers. Tier 1 is the most restrictive. Tier 4 is the least restrictive, but there are still restrictions in Tier 4. And Monterey County fell into Tier 1, also known as the purple tier. So again, that's based on our case rate. One thing I want to point out is that the state has recognized that the number of cases per 100,000 population depends on the extent to which a county is testing residents. And if there's decreased testing, then there could be people out there with COVID that don't get tested, but otherwise, if they had been tested, would add to the number of cases. And so, and then if a community or county, or if a community and a county has a lot of access to testing, and there's a higher rate of testing, that county is more likely to find those individuals who are infected with COVID and confirm that they have COVID-19, and that would increase cases. And so the state has a correction factor which attempts to take that into account to adjust each county's case rate. So there was a mild adjustment to our case rate, and that's because I believe the testing rate in Monterey County was a little bit lower than the state average. And that's what the state is using right now to make that determination of whether or not an adjustment is necessary, comparing the testing volume from a county comparing it to the state average. And so there was an adjustment, a slight adjustment, but even without the adjustment, we were still falling into Tier 1. So what does that mean? A few things. I'll mention the business side and then the school reopening side. On the business side, it means that many of the restrictions that were in place with the prior county monitoring program are still in effect under the tiered framework under this new blueprint for a safer economy approach that the state has transitioned to. And so many of the services that are allowed to be provided only outdoors remain as only outdoor services. And as a reminder, the guidance documents that the many guidance documents for the various industry sectors that the state has put out over the last few months are still in effect. And if if a certain business finds itself described in one of those industry sector guidance documents, they are to follow the guidance while looking at the any restrictions that apply to Monterey County because we're in Tier 1. So, and we have done our best to be available to businesses that have questions about the guidance and questions about the tier as to whether or not they can open, if they can open or remain open. Are there any new restrictions, or are the restrictions the same? So we'll continue to try to make ourselves available to the business owners who have those, or managers of businesses who have those questions. On the education side, as I understand, the being in Tier 1 means that schools cannot reopen for in-person classroom instruction unless a waiver is submitted by the school, and that has been discussed with this group over this past summer when that information was first released by the state. They can submit a waiver, and the local health officer with consultation by the California Department of Public Health could consider a waiver for a school while we're in the Tier 1 to provide all or a portion of the instruction to be in person. However, any county that is in Tier 1 like we are, whose case rate is twice the threshold that the state has created, cannot consider the waivers until the case rate drops below twice the threshold. So the new threshold that we're looking at as a daily threshold would be 7, and our case rate is 15. And so double 7 is 14, and we're above 14, which means that at this time, our public health department and the state California Department of Public Health are not considering waivers from schools. Although schools can, of course, put together their plans and have their waivers ready to go should we drop down below that amount, or should we drop into or even drop it down into the red tier or Tier 2, where schools can then resume in-class instruction. So those are the two main areas that are impacted by the tiers, the new tier framework, the business sector and the education sector. So where are we at now? We were able to look at the case rates over the last 3 periods that the state has been measuring and tracking for the purposes of the transition to the tier framework. And we were able to release a media release this week explaining that our case rate has dropped from the week of August 11th, which was the first week that the state has used to start monitoring counties through this new blueprint approach. And in that week, our case rate was 20.7 per 100,000 residents. And over the subsequent 2 weeks, it has dropped. And for the week of August 25th, which is the most recent week that the state has reported on for all counties, our case rate is 15.9 with the slight adjustment, but it's 15.9. And so in addition to that, our testing positivity rate has declined from 12.5% to 9.9% over those same periods of time. So I'm hopeful that the effort that Monterey County businesses, Monterey County residents, our families have taken to follow all the infection control, infection prevention strategies is contributing to, in part, to this this decline. We'll, of course, see over time whether this becomes a trend and moves us down into case rates that where the state would consider moving us through into a different tier in the weeks ahead, which would allow for fewer restrictions, or loosening of some of the restrictions on the business sector side, and also allow for more options for schools who may wish to provide in-person instruction. So I really, really encourage everyone to keep doing what you're doing. Don't despair. Don't think that your efforts aren't paying off. They are paying off. We have been able to, at least until now, avoid surges to our hospital systems, surges to our emergency room services, surges in our ICUs and intensive care units. And so I believe it has helped pay off there. And hopefully we'll continue to see not only just stabilization of our hospital census and ICU bed occupancies. Hopefully we'll also be able to see some improvement in the case rates that the state is using to determine how loose or how restrictive businesses and schools must be. So thank you, Maya.
Thank you, Dr. Moreno. And we've got a lot of questions. So for the time that we have left, we're going to get going on some of the questions. This first question is for Tracy Mofino. I hope he's still on the call. Is there any update on Social Security services at the LAC?
The state unemployment folks were there, so SDDS was there, but not the federal Social Security office. They're swamped as well, trying to get services throughout the state to all the other LACs.
Okay, thanks very much. There was a question and then an answer in the chat, and I'll go ahead and read it for those who are watching on YouTube. When is the library in King City going to close their services for fire victims? And Hillary Thayer responded that the center is open until no longer needed, and she also provided, for those in the chat, provided information and phone numbers for other services. Here's a question for our interns about the WhatsApp program. Maria and Alondra, how many people are in your WhatsApp group right now?
This morning we had about 20 people signed up already.
Great.
And I'll add in that we just started it like 2 days ago.
Right, well, hopefully by tomorrow those numbers will grow.
Yes.
All right. Turning to a question for Dr. Moreno, you were talking about schools and waivers. This is a question about what about school cohorts being able to operate in our current status? You're muted.
Thanks again. So yeah, thank you for the question. So this was from the California Department of Public Health. This guidance is on their website, and basically the California Department of Public Health has shared with us that they recognize that there are, based on the experience with distance learning towards the end of last school year, they and others recognize that there are challenges, some exceptional challenges that certain children or families have with distance learning. And so given that many California schools started this school year with distance learning, I believe that what, as it's reported to us, the intent here from the California Department of Public Health is to recognize that there's a need for some supplemental and support services and programming for some subsets of children who would otherwise struggle significantly or fall behind in either their education or services that are necessary in order to maximize their learning capabilities because of some learning challenges that some students have or other circumstances that the school may be aware of. So this guidance does allow for cohorts of children to come together. The size of the cohort is included in the guidance, which is not more than, I think, 14 children, and that group can have one or two consistent adults to supervise this group. And these can be in the indoors or outdoors according to the guidance. And the intent of the cohort, or the reason why it's a cohort, and not larger groups, is that if one or more of the children or the supervising adults were to become infectious with COVID-19, the size of the outbreak would hopefully be contained as much as possible to that cohort, and with isolation and quarantine, that cluster could be minimized. So smaller cohorts are better than larger cohorts in this instance, in trying to continue to slow the spread of COVID-19 while trying to make well thought out efforts to try to get the children what they need to maximize their educational experience, so that when this COVID pandemic is over, more children had an experience that did not significantly delay their educational advancement and ultimate attainment. Hopefully that helps.
Yes, thank you. I have another question for you, Dr. Moreno. With case rates and the testing positivity rate improving, is there a target date that the county is looking for to be able to enter the red tier or tier 2?
Thank you. I would have to say that there isn't a target date, but I think that our community, our health department, our community, and our schools and businesses should continue to plan for a time when the restrictions are loosened, and be ready for that time. As I've seen with this pandemic, there's a lot of change from, it seems, from week to week sometimes with this virus. We've seen almost a flattening of the curve early on in this pandemic, and then we saw what seemed to be the beginning of a sharp rise of cases and hospitalizations, and now we're at a place where our positivity rate and our case rates seem to be probably leveling off, at least for the moment. The decrease over the last 3 weeks suggests a leveling off, and we'll know better whether or not if that continues, whether that represents a trend downward, which would get us into the red. So again, I don't have a target date, but I think we should all continue to plan for a time when we can engage in more in-person student instruction and looser restrictions for our businesses.
Thank you. And this next question is similar to the previous question, talking about the improving numbers. Could you comment on the relatively steep drop in the number of new daily cases reported over the past week? For instance, only 23 new cases were reported this morning.
Yeah. So, yeah, thank you. So it wasn't too long ago that our Public Health Bureau and our health department was receiving over 100 new cases a day. And what we've been observing, as was suggested based on our postings on our website, is that the daily numbers have decreased. And so fortunately, I and my staff continue to participate in statewide calls with other health officials and leaders from the California Department of Public Health. And one of the topics of discussion has been what appears to be a decrease in cases. And looking into it, the state has shared with us that they've identified a decrease in testing volumes across the state. And so one of the things that may be contributing in part to the decrease in the number of cases that we're seeing is that fewer people are getting tested. We do know that people that have tested positive really don't have a need to go back and get tested again. So there is a segment of our population who are done with testing, at least for the time being. And as we are able to successfully get more information out to businesses and employees, they're beginning to realize that once you test positive, you don't need a repeat test to come back to the workplace. Once you're positive, and you could be positive for 2 or 3 months, but your infectious period is basically those 10 days. And then after those 10 days, if you're feeling better and you don't have a fever, it doesn't matter what your test result is because you're not infectious anymore. What the investigators and researchers are sharing is that what they think is happening is, in that case, I'm getting a little off topic, man, but I'll get back on topic in just a minute. The virus may still be found in the mouth and the nose and the throat of people who are infected, but that's dead virus, and the body is basically fighting off the infection, and that person's no longer infectious, but you can still detect the virus. So as more businesses understand this, fewer people are going to get tested, and that might also contribute in part to why we're seeing fewer cases. In prior months, when someone tests positive, they may go back and get tested again, or 2 times or 3 times, because they're looking for that negative test. And those, there's a lot of that kind of represents how eager people were all to get tested for a variety of reasons. So getting back on target, we have a decrease in cases. I think, though, that we still need to let our community know that testing is still very important. That if a healthcare provider recommends that you get tested for COVID-19, my suggestion is you take that health provider's advice and get tested, so you know whether or not you're positive and infectious, and if so, you can take proper steps to isolate and from other people, so we don't infect other people. So I hope that helps in some way, Maya.
Thank you. And I'd like to squeeze in a follow-up question from an earlier question about school cohorts. The follow-up question is, wouldn't nearly all students benefit from cohort learning given the widespread struggles with distance learning?
I think that there's, these schools are probably best suited to answer those questions. The schools are, each school has unique characteristics of its school community, and the schools can decide which subsets of kids would need the most assistance and would benefit the most from cohorts. There may be some students that in schools that have adequate resources. They've got fast internet, they've got enough devices, and support at home with older family members, adults, grandparents, for example, who can assist them with their studies, and they may be able to do adequately. And in that situation, perhaps the risk of going into a cohort where you might get exposed is greater than the benefit of the little bit of benefit they might get from joining other students when they can do all that online if they have all the resources. So that's, I think, a decision that the school's going to have to make, as they know their student body the best. They know what resources their students have, or resources they don't have, and what shortcomings have had the greatest impact on student education for their schools and their community. So that's probably going to be the large part left up to the schools, but we here in public health are very want to try to do our best to be available to provide some consultation and any advice that might be helpful to our schools who are contemplating how they might use the cohorts.
Thank you very much. And that is all the time we have. We're a little bit over our hour, but we wanted to squeeze in that last question. Our next briefing will be on Monday. Thanks to everyone for joining us today, and we'll see you next time.
Thank you, Maya. Thank you.